In an important ceremony that underscored the growing medical cooperation between Sierra Leone and China, the Leone-China on-site First Aid Training Center was officially launched at the Leone-China Friendship Hospital in Jue. The event, hosted by the Chinese Embassy in collaboration with the Ministry of Health and Sanitation, was organized by the 26th China medical team and featured slated dignitaries who outlined the strategic importance of the initiative. The on-site First Aid Training Center is designed to provide real-time, hands-on instruction for hospital staff and community volunteers, equipping participants with essential emergency response skills. The project represents a tangible extension of the long-standing health partnership between China and Sierra Leone, with a focus on improving emergency care, reducing preventable fatalities, and strengthening healthcare system resilience. Dr. Long Fin, team lead of the 26th batch of the Chinese medical team, delivered a remarks highlighting the collaborative spirit and the mutual commitment to advancing emergency medical training in Sierra Leone. Dr. Liu emphasized the center's role in building local capacity to respond swiftly to medical emergency across the country. Chen Shi, Deputy Commissioner of the Hunan Health Commission, conveyed the importance of the Sino-Sierra Leone Health Cooperation and expressed confidence that the training center will serve as a model for similar initiatives in the region. His Excellency Ambassador Wang Qin, Chinese ambassador to Sierra Leone, articulated the broader vision of China's medical aid program, noting that the center will contribute to improving emergency care delivery, align with international best practice, and fostering people-to-people tie through healthcare.
During the last 5 decades, the Hunan province had dispatched 26 batches of Chinese medical teams with a total of 400 members. They treated more than 1 million patients, completed more than 200,000 surgeries, and trained over 6,000 local medical workers. We could never have achieved this without the support from Hunan province, from Hunan Health Commission. Today's launching of this first responder training center is one of our latest efforts to enhance the functionality of China-Sierra Leone Friendship Hospital. Last year, we agreed to build 3 centers in this hospital, which are the Traditional Chinese Medicine Center, the Telemedicine Center, and this first responder training center, to enhance healthcare service and the capabilities of the hospital. After 1 year's hard work, we are glad to see we launched the Traditional Chinese Medicine Center in February, together with concluding the Traditional Chinese Medicine Community Intervention Program. We launched the Telemedicine Center in June, together with the Paired Hospital Mechanism project. Today, we are very happy to launch this first responder training center, also to hold a health campaign and a free clinic for celebrating the World Heart Day.
Dr. Sati Kane, Chief Medical Officer of the Ministry of Health and Sanitation, delivered a keynote address. Dr. Kane praised the collaboration as a vital step towards enhancing Sierra Leone's capacity to handle medical emergency and reiterated the government's commitment to strengthening healthcare services nationwide.
We are working with a team, and there are plans with the Paired Hospital project we've started, is rolling out, supporting these units, and today we are doing an on-site first aid center opening. That is phenomenal. And you know what? The location is very important. If you look at the length and breadth of this country, there's no tough and good hospital from the provinces as you come to the city. Having this hospital here and having the capacity to mount the strongest first aid center here, you know what that means for for the numerous road traffic accidents, for the numerous problems that happens to people. So this is the beginning of turning this Joy Hospital to something we want. And in the future, because of the President's challenge to the ministry, we hope together we'll work with the Xianya Hospital and the Hunan province to make this an orthopedic center. Interestingly, you may not know, yesterday we have agreed, because it came from the Chinese team, and no less the person that the deputy commissioner. We will be using the Chinese team here, not only for Joy Hospital going forward, but for other hospitals. You may not know there are professors that are here that you are not tapping into their strength. And we do not want to keep them here without performing what they are supposed to perform. And interestingly, maybe you may not know, Chanjuren, the medical school is just behind this Joy Hospital. Do you know that? Yes. So having the medical training school here behind this hospital is an opportunity that people, consultants, professors here could lend services in training our medical doctors. And at the same time, so the minister has taken that yesterday, we internalized it, and we will definitely make that to be something that will function, that will work. So we are poised to that, and we hope that when we all put our hands together, China Friendship Hospital will become an epitome of excellence in this country for healthcare delivery. And I hope by that time, me and the permanent secretary will not be signing too much money out of this country for people to go overseas, Ghana or other places for medical treatment.
A formal plaque unveiling signified the official opening of the on-site First Aid Training Center, marking a ceremonial recognition of the collaboration and its anticipated impact on patient outcomes. Representatives from both sides conducted an inspection of donated medical supplies, underscoring the practical contribution accompanying the training initiative and ensuring transparency in the aid process. Dignitaries also made a conducted tour guide within various departments of the Leone-China Friendship Hospital. The tour provided a closer look at the center's integration with existing hospital services and offered a platform for observing ongoing World Heart Day promotions and free clinic activities. The program also showcased World Heart Day activities, aligning the launch with a broader public health awareness effort and encouraging community engagement in cardiovascular health. The on-site First Aid Training Center is expected to bolster frontline emergency response capabilities, enhance clinical education for local staff, and support rapid life-saving intervention in trauma, stroke, and other critical conditions. By combining training with ongoing access to medical supplies, the initiative aims to reduce response times and improve outcome for patients presenting with acute emergencies. For Star TV News in Freetown, I am George Elliott Sam reporting.